This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo. This week on the program, we will visit with two members of MSTEPP. That's the Mohave Substance Abuse Treatment and Education Prevention Partnership. MSTEPP is a multidisciplinary community organization with the stated mission to decrease substance abuse and ensure adequate and accessible substance abuse treatment services in Mohave County. My guests are Robert DeVries, he's the former chief of the Kingman Police Department and the current project director of MSTEPP, and also joining us is Keli Hardy, peer support with MSTEPP. Welcome to the program.
Thanks, TG.
Thank you.
Chief, I'd like to start with you if we could. It's been some time since our last radio interview, and I often say this during interviews, but it's worth stating again. Focus on Your Health is about health and wellness. It's not a political show. There are enough political shows on the radio. Having said that, we know that within the last year, many local community programs have lost government funding. So I think this is an important place to start. Did this affect MSTEPP?
Well, there was some questions as to how it was going to impact us because we do receive drug-free communities funding as a grant through the Center for Disease Control, which was under some scrutiny. And I can say that we actually went through a DOGE inquiry, Department of Government Efficiency, where they had reached out to us in regards to a reimbursement. We were able to provide everything that they wanted, and there was no issues whatsoever from that. So there was questions as to would funding be continuing on, and we're very happy to say that yes, it is continuing on, and I believe it's because the programs are working and they're showing results.
And this is kind of a case where you had to justify your existence.
Exactly, where they were wondering, because in the past it was very minimal documentation. So we welcomed it. We've had all of the documentation. We know where every penny is spent. And there was no scrutiny whatsoever over our expenditures.
But given your career in public service, you're used to taking good records and you're used to those moments where you have to justify certain expenses. Is that
Absolutely
fair to say?
Absolutely.
Yeah. So what's the current financial health of MSTEPP?
MSTEPP relies heavily upon grant funds. Our primary one, as I mentioned, is drug-free community grant funds, as well as we receive some state opioid response dollars. Additionally from that, we receive both City of Kingman and Mohave County opioid settlement funds, which are dedicated specifically to programs that we're going to talk about. One of them is the Quality of Life Court, and the second one that we just recently launched through the City of Kingman is to fund Hobbies Not Habits, teaching our youth about healthy activities, healthy hobbies to get involved with versus going down the wrong path. Mm-hmm. And then beyond that, one of our primary supporters out there is Kingman Regional Medical Center, because we're addressing the substance use disorder aspect under the Community Health Improvement Plan.
So the financial health, the outlook is promising or is stable, or what's the right term for it?
It is stable. I believe the opioid settlement funds run from a range of anywhere from 7 to 18 years, which we're hoping to, by that time, solidify it into the department budgets as well, so that can be a long-run program is what our goal eventually is. As for the Drug-Free Communities Grant, we're now finishing 5 years. We have an opportunity to go for a second 5 years. It's a competitive grant, but again, we're confident going into it, and it's been based upon the results that we've experienced over the last 5 years.
Is it also the case that sometimes new funding or new grants become available and then you have to be aware of those and apply for them?
Absolutely. We're constantly looking and viewing as to how things could possibly fit and where we could use those funds to better the community.
Well, Keli, the chief kind of set the table for us regarding Quality of Life Court. First, I wonder if we could just talk a little bit about your work in peer support. How did you become involved with MSTEPP?
I was actually a former client for MSTEPP. Mm-hmm. I was in the program for a little over a year. It changed my life for the better.
Are you willing to talk a little bit about how it changed your life or how it changed your perspectives?
Yes. I lost everything. I had hit rock bottom, and some people say that rock bottom has a basement, and that was me. I lost everything. Yeah. My children, my family stopped talking to me, my house, my job, my cars. I was at the point where I didn't care anymore.
What was it about the program? I mean, it sounds like you were ready to make a change, but what was it about the Quality of Life Court and the program that kind of helped you get from one place to where you are today?
Honestly, the connection and the love that everybody, the support, the connection, the love that everybody showed. Yeah. It's like a family.
And now, as peer support, you have the opportunity to open those same doors for others. Is that right?
Yes.
Tell me a little bit about your work now, what it entails.
I do classes. I teach my clients to give back to the community. That's important because we took so much in active addiction.
When you first meet with a client, how does that go? What is that conversation like?
I explain how I became in the quality of life and how I got clean and how it has changed my life. And then I also, when we meet, I'll do like a one-on-one with them and I'll kind of get information about their background and how to better help them.
Tell me a little bit about what this work means to you.
It means everything to me. It brought me my life back and then some.
How does someone become involved in Quality of Life Court?
They will get a drug charge, and they'll go before, I do believe, Wendy. Wendy screens them. So if they're eligible, they'll be asked if they would like to change their life, if they would like to be a part of the program.
And some of them will say they're not willing, they're not interested?
There's a lot, yes.
Yeah. And so what's your take on that? Maybe it's just not time for them yet, or?
Unfortunately, yes.
Yeah. So assuming that someone says, I'm interested, what are the parameters in terms of eligibility?
Well, you have to be willing, right, to make a change.
Sure. Yeah.
There are 9 hours of counseling that they have to have a week, and that's with Southwest and myself. Every 2 weeks, they have to go in front of the judge, myself and their fellow peers, and it's really an amazing experience to even see from an outside point of view looking in if you go. It's just really heartfelt. The judges really do care.
What are you likely to see? Like if someone goes and sees that?
The judge laughing with them.
Really?
Talking with them like they're just regular people.
I mean, they are just regular people, right?
Yes.
They're going through something.
Yes.
But ultimately, they are just regular people. Chief, I wanted to bring you back into the conversation for a moment. Of course,
Sure.
You had 40-something years in law enforcement.
Short 42-year career.
Just
yes.
a short 42-year. Could you say a little bit about how this sort of scene that Keli describes about maybe the judges laughing and kind of helping to coach people through this difficult time, is this something you saw early in your career?
Yeah,
Really?
It really truly is, because when you're interacting with individuals, they truly feel like if they're suffering from substance use disorder, they feel like they're in a box. Nobody cares. They're just an arrest number. They're just a court docket. Nobody really cares is what their belief is. And when you have to chip away at that wall to be able to get to that person. And you'll hear all of the court staff that are involved with this program will say you can see the moment where they turn that corner and suddenly realize that people truly care. And I think just about every graduate to the person has said that was what made the difference in their life, is realizing that someone cared.
Yes.
Well, and so while people who are experiencing addiction have to make that change,
Right.
I know a little bit about law enforcement. There is a fair amount of, this is a surprise to you, I'm sure, Chief, but there is a fair amount of cynicism. There is a fair amount of stigma involved in against those folks. So similarly, do you have to kind of chip away at those folks to demonstrate the change?
They had to chip away at me.
So tell me, if you're willing, tell me about that.
Yeah, and when I talk about stigma and I do trainings around the community, I use myself as an example, because in my career at the time for medication-assisted treatment, or commonly known as MAT, I didn't believe in it. I didn't think that was the direction to go. Same thing with harm reduction. I did not believe in it, but I was I was fortunate enough to have some excellent teachers, some excellent mentors. Dr. Sarah Knievel, for those who remember Sarah when she was here in the community, was phenomenal. I learned so much from her and recognized that I needed to change my thoughts because what I would look at, and we would always talk, 42 years of law enforcement, and TJ, you're familiar with it, that entire career is built on evidence. Everything we focus on is gathering evidence, providing evidence, for the case. So how can we say that that evidence is crucial, but the evidence that shows that MAT and harm reduction works is irrelevant? You can't do that. You have to realize that there's a place for all of it, and it does work, and I've watched it work. And so I've changed my beliefs, and in talking with individuals, I hope to be able to show them that there is a different side to it.
Do you have the opportunity to speak with other chiefs of police or city managers?
I do. I do. As a matter of fact, I've taught in the court programs for all of the court staff. I've trained the entire Mohave County Health Department as well in regards to dealing with stigma and trying to break down those barriers and recognize them as individuals, not as that court docket.
Do any of your former peers just think you've gone crazy or gone native?
No, they really haven't, because those that know me understand that 42 years, I've always been involved in prevention. I have a different look at it now, and in regards to the stigma of MAT and harm reduction. And when I explain it to them, they do understand. And I think many of them have also changed their belief. And the big part of it is I go back to the whole program of Naloxone. With Kingman was the very first to equip and train our officers to carry Naloxone. There were others across the state that said it wasn't a law enforcement function. They said, let the problem take care of itself. Those were all things I did not want to hear, did not believe in, and felt we could make a difference, and we have made a difference. So it's breaking down those barriers. And then the interesting part when we talk about this is you always hear, well, you can't fight big government. You can, because when we started that program, we had pushback from every level of the state. And now, if you want to be an accredited law enforcement agency in the state of Arizona, you have to have a naloxone program in place within your agency.
Were you at any point concerned you would find yourself in the hot seat over that?
Not that one as much as when we brought in harm reduction, because Mohave County is a very conservative area, and the thought of bringing in harm reduction to the rural Arizona, we were the first rural Arizona community to offer harm reduction. I spent many months before we launched it talking to service groups and any organizations that I could, explaining that Mohave County was in the top 10% for the chance of an HIV or hepatitis breakout. We have to do something different if we want to make a difference. And I think it was based upon the trust from the department into the community that people said, yeah, we're willing to give this a chance. And when we launched it for small, rural, conservative area, we got zero pushback.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo. And this week on the program, I'm visiting with Robert DeVries. He's the former chief of the Kingman Police Department and the current project director of MSTEPP, and also Keli Hardy. She's peer support with MSTEPP. Well, these changes have taken root, if you'll pardon the pun, and I know that we want to talk a little bit about Diggett Gardens and a couple of plots of land. Keli, what's the story there?
I think it's helping them realize that they can do little stuff, right? That it brightens their day. They've never planted a garden before. They've never helped anybody before but themselves. Because right in active addiction, we're selfish. We had the opportunity to grow pumpkins. Oh, we were going to give them back to the children of the program. So some of them got pumpkins, and just to see them come and pick out a pumpkin and to see their little face light up, and their parents, my clients that are in the program, they had tears in their eyes because this is something that they got to do. They got to grow these. They take home the vegetables and they make dinner, and it's just wonderful to see.
Yeah. I mean, it's a small thing, but then when you weigh the symbolism of it, it could also be really significant, right?
Yes, it is.
Well, according to the National Institute on Drug Abuse, People who struggle with drug addiction have a relapse rate between 40 and 60%. And we know that recovery can be a long road. How do you measure success?
We look at the graduates, what we're seeing with the individuals and seeing how these individuals now have their family back. They have homes, they have cars, they have jobs. That to me is success. We do know that relapse has occurred, and it has occurred with some of our graduates. They've never reoffended, and the reason being is when we learn of someone that's struggling, as Keli mentioned, this is a family, and that family surrounds that individual and provides the support to guide them back to where they need to be.
Of course, we'll respect people's privacy, but could you share maybe a story or two about some individual successes?
I have one client, and I might tear up a little bit, so I'm sorry if I do.
I'll get the tissue box for you.
She had a long road ahead of her. She came into the program, and she was just so thin and just frail.
Yeah.
We butted heads a lot. She was fighting her recovery. We did have a lot of things in common. So I took that and ran with it, and finally sat down and talked to her face to face and said, "You can't do this anymore. It's time to change. I know you want to, don't fight it anymore." So she started slowly progressing. She is now 2 years clean. She's off of methadone. She's going to college. She turns around and helps everybody else in the program as well. She comes as much as she can to court still. She still supports everybody. We do have a group chat, so she's in there, and once in a while she'll add her 2 cents in and tell everybody, straighten up. Mm-hmm. But it's just amazing. She's unrecognizable now. Like, she's not the same person that she was when she first came into the program.
Yeah. But, you said you butted heads with her early on, or maybe she butted heads with you, right?
Yeah.
But because of your background, you recognize that as just another symptom of what she's going through, right?
Yes.
And you're able to, you're a significant part of her being able to come through that, right?
Yes.
Yeah. Chief, let's round the corner here. Let's talk a little bit about the street team. What is it?
Street team actually began through the Mohave County Health Department, and Danny Lagana, she was the lead in regards to developing and creating the street team. Because of other responsibilities that she now has, she had asked MSTEPP to take over. And what the street team is really is several dozen organizations across the county that provide a wide variety of services to individuals. And what we do is once a month, we travel to a community, try to get out as much as we can to some of the rural, remote areas. And we'll come out there with anywhere from usually 12 to 24 organizations, and just providing information to individuals on services that are available to all of the residents out there that they may not be aware of.
Specific to drugs, alcohol, other things, or not necessarily?
We provide a lot of the information related to substance use disorder, but it's related to anything and everything from a health. It's a broad-based health-related street team.
Yeah. We know that one of the significant issues facing some of the folks in the rural community is transportation. It's hard for them to get places. Does that make it significant for them when the team goes out there and do the folks out there feel recognized? Is that what you're hearing from them?
Yeah, absolutely, because they're learning about services that they had no idea were even in existence and available to them. We may be able to start out with it, by digital, getting them hooked up into that aspect, and hopefully identify some transportation needs. I can think of one incident we had when we were out in the Dolan Springs area, and I had an employer come to me and said she had an employee who was struggling because of a daughter who was in active addiction and going through some crisis. And so we had a good talk about what services were available, and I said, but we need to hear from her. And it was about 2 weeks later that I actually got a call from the young lady and said she was ready. And because of that, we were able to identify services for her, get her in touch with it, as well as get some transportation for her. So that's the great part about the street team, is if we don't have an answer to a question or a problem, We can put it out to the membership, and typically within an hour to 2 hours at max, we will have the right person and the right contact information to get it taken care of.
The street team has garnered some attention from a health publication. Can you tell me about that?
Yeah, actually, because of the partnerships that we've been able to create, we being MSTEPP, we're one of just over 750 drug-free community programs across the country. We've been selected based upon our partnerships that we've developed and sustainability, as I mentioned, with some of our partners there, that we're going to be highlighted through the Public Health Journal in 2026. So it's something we're very proud of. But that's when we've also had the Department of Justice over the last 3 years has brought communities from across the country here to see what type of programs we're doing and the success that we're having. And we heard from every one of those groups, the uniqueness about here in Kingman, Mohave County, is collaboration.
Yeah.
We collaborate, we cooperate, and we work with each other. We're not here to compete with each other.
This article in the Public Health Journal, it's significant in terms of sharing your story and possibly inspiring others who are facing similar challenges. Does it bring anything else for you? Is it significant in other regards?
I think it showcases what some of the things we're doing right, but it also allows that networking to occur across country, because every one of those groups that came, while they were looking at what we were doing, we were learning what they were doing. When you go to these different aspects, you can always walk away with learning something.
Yeah. With those other jurisdictions that came here and shared ideas, do you hear from them, or when you hear from them, do they ever give you something that surprises you that makes you say, oh, wow, that we haven't tried that, or that sounds like a really good idea?
Yeah, absolutely. As a matter of fact, I was just last week, the Department of Justice had connected me with an individual out of California that's trying to get a take-back program going. So because of our experience in regards to that, with the Leave It Behind program of leaving naloxone at scenes where there's been, say, from a drug task force, evidence of opioid or fentanyl use, we leave naloxone behind. And same thing as if there's an overdose, they will leave naloxone behind, just trying to save lives.
We've been talking about MSTEPP, that's Mohave Substance Abuse Treatment and Education Prevention Partnership. Does MSTEPP need additional volunteers?
Always. We welcome anybody to the table. We meet monthly at the KRMC at the Hualapai campus in the conference room on the first floor level. And it's the third Tuesday of the month at 4 p.m. Anyone and everyone is invited. We go over basically all of the different activities that are occurring, new programs and activities that are going on. As a matter of fact, in February, Magnet, our county drug task force team, will be coming in and providing a training for everybody on the drug trends that they're seeing in the region.
So if a listener is sitting there saying, oh, this sounds interesting, but I don't know what I have to contribute,
come to the table and find out. They may find that there's things there that they really want to do that might be not necessarily everybody's cup of tea, but I think we have a variety of things that they can get involved with and interested in and walk away with a sense of worth.
In the moment that we have left, Keli, tell me a little bit about what is ahead for MSTEPP and in particular Quality of Life Court.
We are giving back to the community. We have little kits that we put together and we take them out to the homeless. We do that on Wednesdays that we don't have court. We also are at the food bank, and we help the food bank, the local food bank here in town.
You know, we're going to continue to try and provide the best in services and get these programs long-term sustainability is our biggest goal for us, and continue our outreach. We're working diligently to drive down our overdose death rate here and just continue to educate and hopefully save lives.
You've been listening to Robert DeVries and Keli Hardy, both of MSTEPP. Thank you both so much for your time today and all that you're doing for the community.
TG, thank you for the opportunity.
Yes, thank you.
And that is another edition of Focus on Your Health. I'm TG LaFredo. Thanks so much for listening. We'll catch you next time.